We come to this as well. Many people are often happy to see the back of the cold winter months, but summer brings with it its own downside. We've entered that time of the year when we find our sleep disrupted by an annoying sound. I'm sure you're very familiar with that very annoying mosquito sound. But for a lot of people, mosquitoes bring with them a life-threatening disease, and that's called malaria. Now, NICD Principal Medical Scientist and Head of Laboratory, Dr. Jaishree Raman, joins me now live from the capital of Kampala in Uganda to discuss this even further. Doc, thank you so much for your time and a very warm good morning to you. Let's start with some of the malaria endemic areas that people need to be aware of, especially because that might be a season for planning a trip or two with family, given that the festive season is upon us. But what are those malaria endemic areas that we need to be aware of?
So in South Africa, it's definitely the low altitude areas of KwaZulu-Natal, Mpumalanga and Limpopo. And then within the SADC region, we've got another 13 other countries that are endemic for malaria. So you really need to be able to look at your malaria risk areas to find the areas. But definitely in South Africa, it's KwaZulu-Natal, Mpumalanga and Limpopo. Definitely the border regions.
Absolutely. And also when we talk about cases here of infections, cases of deaths, what does the data tell us?
So definitely at the moment, Limpopo is the province where we seem to have the highest number of malaria cases. That's just local cases. But quite interestingly, we have a high number of cases that are reported in Gauteng, though it's not an endemic area, but that is really due to people coming into the country with malaria. But in terms of endemic provinces, KwaZulu-Natal has the lowest number of cases currently.
Also, some might be keen to know the causes of the malaria season and why it's particularly, at its, highest number at this time of the year. So can you just share with us perhaps the causes of the season and why particularly around this time?
Absolutely. So summer is the ideal time when there's enough rain, which the mosquitoes need for breeding. And we also have ideal conditions where people are outdoors more, so they're exposed more to the mosquito. So it's really the climate, warm weather, and ideal breeding conditions for the mosquito, and people are more exposed to the mosquito, so it allows for better transmission.
Doc, what's the impact of malaria on children? And I suppose we can even compare this to adults, if the comparison even exists at all.
So in areas where malaria is very, very high transmission intensity, children under 5 are at greatest risk. In South Africa, because we don't have such a high risk of malaria, the entire population is at equal risk of malaria infection. But in areas like, just let's say DRC, for example, children under 5 are definitely more at risk. But if you are South African and you have a child that goes to malaria endemic area and gets infected, they really need to get treated very soon because they are at risk of complicating malaria very quickly.
Right. And you spoke of treatment. What does then treatment look like for malaria?
So we have a very, very effective treatment in place as long as it's taken correctly. So it is an artemisinin-based combination therapy. In 3 days, if you are detected early and you are treated early, and within 3 days, you normally have good recovery and you start feeling well.
Any precautionary measures under the same breath that people need to be, aware of?
Absolutely. So if you're traveling to malaria risk area, you've got the option of taking chemoprophylaxis, which is now available at pharmacies without a prescription from a doctor. If you don't want to take chemoprophylaxis, then you can use non-pharmaceutical measures like Tabard or peaceful sleep. Make sure if you are exposed to mosquito bites, you try to reduce the risk of it by wearing long-sleeved shirts, long trousers, cover your ankles with socks. And also, if you're sleeping, sleep under a bed net or with an air conditioner on because that disrupts the mosquito from reaching you.
Yeah, that's absolutely, I think, ideal. So to try and, avoid those bites there, Doc. And lastly, before I let you go, can you perhaps share with us the duties here of healthcare workers that they still need to be aware of, even in non-endemic areas? Because like we said before, there's a lot of traveling that might be going around during this particular season. And even though a health worker is not necessarily in a malaria endemic area, but are operating and working in a non-endemic area, they still need to also take some precautions with their patients.
Oh, absolutely. And it's really very pertinent now because we're starting to see an increase in COVID cases. So a lot of healthcare professionals are thinking that fever is going to be COVID, but fever sometimes might also be malaria. So it's really important that they also ask patients if they've traveled to a malaria endemic area and consider malaria, because the malaria test is really easy. So healthcare professionals must keep malaria very high on the agenda, particularly as we are in the malaria season now.
Absolutely, Doc. And I think even for patients themselves, it's good for them to have this information so they can volunteer the information first whenever they do consult. That helps their healthcare worker, of course, to know what exactly they're dealing with. But thank you so much, Doc. We have to leave it there. Dr. Jaishree, Raman, thank you for your time and speaking to us about this. Malaria cases currently on the rise during this particular time. Please, if you're traveling, know your malaria endemic areas. Limpopo, as well as KwaZulu-Natal and Mpumalanga being one of them. Make sure that you do your research and take all the precautionary measures that you need to stay safe.